Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner. It's April 1st. I was going to try and do like I'm Amy. I'm a board certified plastic surgeon, but
you are.
I'm not. But I am joined today, as always, by my world famous co-host, Dr. Jason Martin. He's a board certified plastic and reconstructive surgeon, for real.
Extremely famous.
Yes. Dr. Martin, how you doing?
Good. Thank you so much.
I thought we should have something fun for April Fool's Day, but honestly, we've just been so busy. And with having my assistant out for 2 weeks with that word that no one says.
Can't say the word.
Yeah, it's been a little stressful. So here we are. That's all I can say for today. We are here.
We are here. We made it.
And it's April. And like, oh my gosh, it's finally almost spring. So.
And it's Final Four. I mean,
no,
March
it's not.
Madness.
Oh yeah, that's right. Because it's this weekend, right? It's the 31st through the 1st.
Yes.
Yeah. You're right. Yes.
Elite Eight, Final Four, something around there.
Yeah. Awesome. Well, we have a very exciting topic today. We are talking all about body lifts. Body lifts are a big surgery. It's not like one of the easy surgeries that we do, for sure. It's not to be undertaken lightly. And so it's maybe not the most popular of topics because a lot of people are maybe not candidates for a body lift. But if you are and you're interested in hearing more about it, you're in the right place. You can also find us on YouTube at Jason Martin MD if you want to watch the slides that go along with this video. They're in a whole ton, but you get to see us, and that's kind of more interesting. I always think it's more interesting to see people when you're listening to them.
I feel like everyone's wondering what Amy's hair is going to look like each episode. It's either up or... And somebody asked me recently that she always wear flowers in her hair.
I mean, for the most part, I do.
And I was like, I have no idea because you're basically a family member, and I don't really look at you. You're like if you would consider, do you look at your arm, right? Do you look at your foot very often?
Not very often.
You're like a part of me. So, do you wear flowers every episode or not? I couldn't even tell you.
I would say 99% of the time, nils. Yeah. In fact, I was watching one of our older episodes when I had the black flower, which I have lost, which makes me really sad. I need to get that black flower back, so I'm super bummed. But
so where do you think the black flower is? I mean, where could it be?
Who knows? Yeah. Who knows? I mean, it probably just fell off one day and I didn't notice. But it is a weird thing having curly hair. I was talking to Catherine about this. I'm like, because it surprises even me. Like, I look at it sometimes and I'm like, why are you doing that?
Right.
Like, what is up, hair?
So why don't you just straighten it? That's what curly haired people do. How hard is straightening the hair?
Well, I would never, because like it's not that I dislike the curls. Like, I kind of find them fascinating. But it's just more that like I don't have to do anything to make them do it.
Yeah.
Like, I just wake up and it looks like this, and it's always a little bit surprising.
Who is it? Was one of the stylists you sent me to. They said, well, how do you like your hair? I'm like, whatever I like for my hair, it has to happen in 20 seconds.
Yeah, there you go.
Whatever I do, it has to be
fast.
a 20-second routine.
I mean, that's kind of mine. I can't even imagine if I had to actually do something to it. But it is, it's
I
weird,
bet you
though.
straightening probably takes a long time.
I mean, like, to see it, like, how does it know to do that? And it like has happened my entire life, and it just keeps doing it.
Yeah, and you're
I mean, like, in one day, am I going to just wake up and it's not going to do it anymore? I don't know. So it's life is a mystery.
It is such a mystery.
Yeah.
That's good.
Like body lifts, life is a mystery.
Yeah, it is.
So let's start off this episode like we do our procedural episodes, talking about the word I hate, statistics. The statistics. If you haven't listened to our episode from March 15th, this is the April 1st episode, you should really go back and listen because my whatever rubs off on Dr. Martin in that episode. And there's a lot of...
I was saying myths, MYTHS, as mists.
Yeah, it was good time.
I don't know what was going on. Armpitness, which is not something you want to take part in at all.
It was the best.
All right, so let's talk about the stats. Why don't we just say stats?
The stats?
Yeah.
So these are still from 2020. Usually it's about, we're almost always at least, 18 months to 2 years behind the current year. So we're looking at the statistics from 2020. And interestingly enough, I found this so fascinating.
All right, don't tell me. Did it go up or down? Okay, is that what you're saying?
Yeah.
Interesting? I'm not looking.
Okay.
So I bet you it went down, not up.
It went up by 3%.
Okay, well... Yeah.
Hey, it's one of the only surgeries that went up.
Well, because I'm sure there's more bariatric surgery.
Right, but this is 2020.
2020, that's interesting.
That's what I mean. That's why it's fascinating.
Well, I mean, there was more bariatric surgery in 2020 too.
Potentially. I mean, I wouldn't say that that's maybe the cause, but overall, if you look at the change from the year 2000, which is when the ASPS started keeping statistics, it's gone up 3,974%. So this is definitely becoming a more common surgery. And as Dr. Martin kind of alluded to, it's perhaps because of the increase in things like bariatric surgery. Definitely more women than men. If you look at the breakdown of men versus women who get this procedure, women make up the large portion of it, about 90%, and men are about 10% of the total. Or 91 and 9. Oh, there it is. It's right there. I could just read the page. I don't have to do math in my own head because we all know how good I am at math.
Yeah.
The numbers. I'm so good at those. So the age breakdown I found really interesting too. What I found so fascinating was actually the 44 or 40 to 70, let's say, is the absolute highest age group that does this, which I found surprising, which I think kind of goes a little bit against the bariatric theory.
Right. It's also age-related changes.
That too.
But, I think it's more the cumulative effect of multiple weight loss episodes and aging. Then you get to this super kind of ptotic or saggy appearance that would lead someone to do a body lift.
Right. Or massive weight loss happens quickly. And we'll talk more about like what makes a person a candidate for all this. But the lowest age group was those under 18, let's say, and then over 70. Obviously, those are going to be the smaller age groups and kind of evenly distributed throughout the 30s, and then more so in the 40 to 55. And then
so normal distribution.
Yeah.
Yeah.
Well, typical for cosmetic procedures. I mean, some of these things too.
Statistically speaking, I can't say statistics now.
No, you can't. It's one of those hard words to say, just like myths.
Oh my God.
I am so taking over on the speech
I
impediment.
never had speech problems till you and I started working together.
So for the last, 15, 16 years.
It's pretty much.
So all of your 40s and some of your 30s. But these things do make sense too if you think about, this will sometimes be a self-pay procedure. And if it's self-pay, where people have money to drop on a surgery that's this involved, is usually kind of going to be in those older age groups. So makes sense from that standpoint. So let's talk about the kind of basics. Like first off, like we'll do who is a candidate. We're going to skip to who's a candidate first. Sorry, Nils, I'm pushing up the slide. So who is a candidate?
Well, I think we need to first start by saying there's two different body lifts that we talk about.
Well, then we'll go back.
Upper and lower. No, I just want to make sure everyone knows. We actually have an episode on upper body lift.
We do.
I'm not sure what number that is, but Nils will tell us. So if you're...
It's dropped here, and there's a link in the description box below.
I love editing, I wish your whole life could be edited. You just say something and it just pops up right here. Anyways, so a lower body lift is what we're talking about today, and upper body lift, you can go watch that episode. But lower body lifts really affect a lot of different areas. And lower body lifts don't fit within one paradigm. A lower body lift can just be the posterior or backside. It can include the front, and it can include the sides, something called a belt lipectomy. So it gets a little bit more complicated, it gets in the nuance. But imagine, overall, a body lift incision would go around where a belt would go. And literally, in most cases, it's circumferential. So that would be called a circumferential body lift.
Yeah. And for purposes of this episode, that's what we're talking about is a full body lift. We have other episodes on butt lift and abdominoplasty.
Oh, yeah. We have a butt
lift
episode too, which I'm going to put right here.
We have lots of episodes on those things. So for the purposes of this video, we really are talking about what most people would think of when they think of a body lift, which is that all the way around. You're lifting the whole thing up, the whole lower half.
Yeah. So where a belt goes, if you're wearing a belt in a normal position, that's where your incisions would go.
Well, I don't know if that's really true anymore because people wear their pants really high.
Oh, they do?
Yeah. Like high rise
all the kids are doing
really
now?
in. So I would say it goes where like even below where your underwear line would go.
Okay, that's better. Underwear line. Yeah. And then you'll dip down at the top of the butt into the
the fold is not a handle.
Okay.
The crease is not a handle.
I always go back to that.
Darwin.
Only the OG listeners will know about Darwin.
No, the crease is not a handle.
In your massage. So it goes down into the butt crack. We're allowed to say that. And it also goes in kind of the pubic hair area, just kind of where tummy tuck scars go. So those really are lower than the underwear line. But as you
way lower than a waist or your belt.
Exactly. Yeah. But as you track around, it goes a little bit higher over the sides, or what we call the flanks. It is a really long surgery. It's one of the longest surgeries we do. If you're talking about a circumferential body lift, that's the front, and usually that includes a full tummy tuck in a lot of cases, but it doesn't have to. Goes around to your sides, which would be, in most cases, something called a belt lipectomy, and then around the back, which is called a butt lift, which we have an episode on that. Then, you're talking about hours and hours of surgery. And, it just depends on the size and severity of the problems, but at least 4 hours, and could be up to 6 or 7 hours, depending on how bad the situation is. A lot of surgery, a lot of moving during surgery. So you're going to be in a laying position and then on your stomach, or start on your stomach and then go to a laying position.
You won't know any of this because you'll be asleep.
You'll be totally asleep. And then, so therefore a lot of surgery, a lot of work, long incisions, and long recovery.
Yeah, I mean, if you think about it, other than a body lift, the longest incisions we do are going to be like a tummy tuck or a butt lift. And at most, the length of those incisions is maybe 20 inches, even on a larger person. Like your hips, hips of a, hippie person are going to be somewhere probably 40 to 50 inches on someone who's really hippie. So you take that and double it and go all the way around. That is a lot of incision length. When you think of something like a facelift, maybe has like 6 inches of incision.
Yeah,
You add it all up.
If that, yeah.
A mastopexy, even a big anchor reduction is maybe 10 inches total. I mean, so just in like the amount of tissue, and also there's so much tension on these incisions, which we'll talk about more when we talk about like risks and complications. A lot of deep layers, like way deeper than like, again, a facelift or a breast lift. A lot of need for like really intense, deep suturing techniques, superficial,
You can't do drainless body lifts.
No.
So there's drains involved.
Definitely not. Yeah. So it's a length of time. And then like Dr. Martin said, you have to be turned like 3 times. And all of that takes time, OR time. So for me, I mean, if someone asked me how long was I scheduling a body lift, I mean, unless it was like no lipo, no nothing else, I mean, I would absolutely book it for at least 7 hours. If it was like a really tiny person who needed no lipo, who didn't maybe have that bad of a redundancy, maybe I'd book it for 5.5.
Yeah, I think overall OR time probably starting between probably around 5 hours.
Yeah, I would say up to 7.
In a lot of these cases, you're not just doing a body lift, you're going to be doing a thigh lift with it, some liposuction of the lower extremities,
breast
fat
lift
injection for the butt or something else. So, there is probably a safe range for operating time. So if you get up around 8, 9, 10 hours, that's probably where you should stop for elective procedures. When you get into these long duration surgeries, you increase the risk of what things, Amy? I mean,
blood clots, postoperative complications,
infection, fluid shifts. People can have cardiac issues or heart issues. It can be longer to recover just from your lungs, something called atelectasis, and postoperative. You can get postoperative pneumonias after having atelectasis. So, in reality, you really have to scope this in. Now, you have to balance that with you're going to recover and you're already in the operating room. So you're always trying to balance the safety versus getting things done for the patient. The big risk, though, truly is deep vein thrombosis and pulmonary embolus. We've talked about that many times before. It's a real problem in longer surgeries. It's a real problem in body contouring procedures that are long. Less common in shorter procedures like facelifts or, even like body procedures we do that are not long, like breast augmentation. Deep vein thrombosis is blood clots that form in your extremities. In most cases, that's going to most likely be your lower extremities, but can occur in the upper. And some of those, when those clots form, they can break off and travel to your lungs, which is a kind of a disaster. So a lot of these procedures will put people on blood thinners or things that
like anticoagulation therapy.
Yeah, decrease the chance that you form clots.
Yep.
So,
and also, part of that too, when you have a surgery that's this extensive, you're going to be slow to bounce back from it. So that's absolutely, I would say, one of the, not really a complication, but an expected understanding of the outcome of this surgery is that you will be a little bit slower moving because you have a large amount of incision. You have surgery on the front and the back side of you. You may have had other things done as well that are going to all limit your ability to really be up moving around at the normal, your normal pace, your normal everything for at least the first 2 weeks.
Yeah, that's a good way to think about it. If you do a surgery like orthopedic surgery or plastic surgery that you're limited on movement, that's where the risk of deep vein thrombosis increases. Because literally, if you do a surgery and you're able to walk right after that pretty easily, the likelihood of you getting deep vein thrombosis, unless you have a baseline issue with coagulation, is pretty small. And so the problem with the body lift is people are slow to go. It's probably one of the more discomforting procedures we do.
Yeah, you just can't get comfortable.
Not that it's like super painful, but like all areas kind of hurt.
It's just uncomfortable
you can't
everywhere.
Find a place to lay or sit appropriately. And remember, when we do these body lifts, we're not doing it with you in a sitting position. And actually, we're doing it with you more in a laying position or a little bit of a laying position. And then what happens is when you sit, you feel a lot of pressure on the incision lines. And so that can hurt. So the recovery is kind of an ordeal. And we've talked about thigh lift. We did a thigh lift plasty. He'll show you that one right here.
Several. Yep.
Episode, which is excellent. So this is like that times something.
Yeah.
It's just more.
What would you say some of the other like possible risks or complications?
The big one. Go ahead. Dehiscence.
Yeah. That would be the number one.
Yeah. By the way, we saw a patient today and Amy saw the patient first and said something. And I came in afterwards, not hearing what she said, and said the same exact thing, even with our hand movements.
Yep. We did the exact same hand movements.
Which is weird.
Yeah. The patient was kind of smirking.
We're like clinical twins, identical twins. Yeah. She said, literally, you and Amy said the same thing, almost in the same cadence with the same hand movements. So dehiscence is the second biggest problem. So deep vein thrombosis can be life-threatening. Dehiscence will not. And that's
just annoying.
Splitting open of the wounds. But you have an incision that goes all the way around your body. And many of those areas are on tension, and you need to have them on tension for them to have any kind of effect. That's one of the hard things about a body lift, and I'm sure we'll talk about this, is you have to really pull pretty hard to have any kind of effect on what you're treating, especially in the butt area.
Well, there's just, I mean, you think about the lower half of your body.
So much weight.
So much weight. I mean, on most people, even like men that tend to not carry as much weight on their lower half, it's still like more than half of the surface area of your body.
It's probably half your weight.
Yeah, exactly. It's probably half your weight, and there's gravity helping it out. Like there is an incredible amount of tension on this incision.
And so, anytime you hope that an incision can hold that much tension, that much weight, then you're probably in a bad position. And it's highly likely that you could have splitting open of the incision, and in its full form would be a dehiscence. And that's, kind of a problem. It's treatable. We've done body lifts where people have had dehiscence, and they get through it.
Rare that someone has like a full thickness. It's usually pretty superficial.
It's pretty superficial
usually. Yeah. Yep. And that happens with tummy tucks. I mean, for that same reason. There's
just
a
lot of times with the body lifts, it's usually on the back, and it's kind of a rubbing problem more than it is like friction. An opening weight, stretch problem.
Yeah, just slow to heal. I mean, there's absolutely, not really a risk. Again, just an expectation of this surgery is that your incision will be slower to heal because there is so much area that has to be healed. And as I mentioned, it's all the way around you, so it's hard to get comfortable. So you're inevitably going to be putting pressure on this incision that you otherwise may not have to if you only had surgery on the front end or the back.
The only way you're really not putting pressure on it is in a standing position.
And even then you are. It's pulling down.
Yeah, I guess that's true.
You really are.
Okay.
Yeah.
An anti-gravity standing position.
Right. Gravity boots. There you go.
Go up in a plane and they do the hyperparabolic movements.
Right.
Yeah. So it's just, it's kind of a problem. Deep vein thrombosis, dehiscence, what would be something else? And I guess scar formation.
Yeah.
Yeah. Abnormal scar formation because there is so much tension there associated with dehiscence and postoperative. You're going to have a higher incidence of infection along the incision lines. It's so long. There's so many areas for potential problems, so infection would be slightly higher. But if you're healthy, you don't have diabetes, don't have hypertension. A lot of people that need body lifts did have diabetes, they did have high blood pressure, and that resolved with weight loss. Okay, type 2 diabetes is associated with weight gain or obesity. So I think that, but still those patients, we've talked about this before, especially post-bariatric patients, tend to be more nutritionally challenged. If you have a true bypass, and then their healing is kind of, in our experience, anecdotally speaking, isn't as good as someone who hasn't had a bypass before. I think the bariatric surgeons would admit that.
Oh, absolutely.
Yeah.
I mean, you are nutritionally deficient
by
for the rest
nature
of your life.
The surgery.
Like that literally is the point of the surgery.
But you could do some things preoperatively. We have good episodes on that too, but to benefit that, but it's hard to overcome the baseline
deficiencies. Yeah, and just the ability to consume enough nutrients. And I think most patients, and this has been our experience as well, most patients who've had bariatric surgery, are at least a year out from their surgery, have maintained their weight for a set amount of time, and are at least accustomed to taking you take prescription vitamin supplements for the rest of your life. Like they kind of know the things that they can eat that are a little bit more nutrient dense, but aren't going to be too much or make them have dumping syndrome or any of the other things that can happen even years later. So, the last thing you want, especially after a body lift, is to like be eating foods that don't agree with you and to be having like crazy dumping symptoms. That's not what you want. So having a good idea of what your nutritional status looks like and how to maintain that is absolutely, I would say, critical if you have had bypass surgery, for any surgery, not just for a body lift, but especially a surgery where you have drains and are having some difficulty sitting and standing, making sure that you're really well.
Going back to one of our favorite episodes, your body doesn't know if it was a very well coordinated samurai sword that did a circumferential
Well, the person was spinning in that case. They were just holding the samurai sword.
They were on a spinning device, and you just held the samurai sword up, or that was a knife. So, it's traumatic injuries that has to be healed. Healing requires a lot of factors for your body. A
lot of energy,
and that comes from nutritional supplementation. Hence the reason that scurvy happened to sailors. They're out in the ocean. They don't have access to certain types of compounds, in that case with vitamin C, and they just don't heal right. That's true for many different vitamins and fats and things that you get in your diet. Amy has, thankfully has taught me a lot of this stuff because that's her background. And you really see that in patients. But it doesn't mean if you've had bypass, you can't do this. You have to be very aware and also go to an office that understands that too. So.
Yeah, and you yourself understand it.
Other than that, there's not like a lot of other risk.
Really.
I guess.
All the risks inherent with any surgery.
When you're talking about complications, I don't know if this is truly a complication. It's not going to be perfect. There's no body lift that's perfect. When you have something that goes 360 degrees. It's 30 inches long. You know,
40 inches
an 8-hour
long, yeah.
surgery. Like there's going to be areas that aren't perfect per se. The scar is not going to be perfect. You know, the body lift will not be perfect, but it could be really darn good. I mean, when I say not perfect, it could be 95% there or 96%.
And this is perfect to the surgeon.
Yeah.
The patient may feel like it's totally perfect.
The flip side of it is it could be way better than what you have now. And patients universally say that too. So, you know, it takes a lot of education, and it's a big, you're jumping into the pool head first. It's scary to, you know, agree to an 8-hour surgery.
Yeah, and I feel like most patients, and this is just our experience again, tend not to start with the body lift. They tend to do things like the thigh lift and their arms, maybe their breast if it's a woman, backplasty. You know, they tend to get those smaller areas out of the way first, which is a smart way to do it.
It is.
You know, by the time they do the body lift,
you get your head in the right place.
Yeah, they've had surgery. They kind of know what to expect.
It's like running the quarter marathon and then you do the half marathon and maybe do the full marathon at the end.
Yeah.
And then you're Ironman level, you know, maybe the body lift's like an Ironman.
Then you're an Olympian. Like, look what happened. Oh my goodness.
We don't want to dissuade people from body lifts. They're one of the most transformative surgeries
Probably
we do.
the most.
Yeah.
I mean, truly.
And I love them, and we do them, not as often as in other places, but I think they, you know, are amazing surgeries, but they're definitely a component to that surgery that requires real dedication. Real education.
As do things like thigh lift too. That's why we harp on that so much on our thigh lift episodes.
I agree.
There's special considerations for sure. Okay, well now we'll go to who's a candidate. Sorry, Nils, we back and forth on the slides there a little bit. So really, I mean, as with all elective procedures, a candidate is someone who, number one, is healthy enough for surgery. I would add on with a body lift that you have been at your happy weight. If you've listened to our other episodes, you know I talk a lot about happy weight, not goal weight. You are at your happy weight and have maintained it for, you know, if you've had bypass, I would say at least 12 months.
I love the idea of happy weight, and I totally agree with you, but like, you know.
And your BMI is under 30.
Yeah,
I mean, that's what I mean. Healthy enough for surgery, number one.
Because you could be at a happy weight with a BMI of 35.
Absolutely, but not healthy enough for surgery.
I have an uncle like that.
Yeah.
So.
Healthy enough for surgery above all else, which means that you are, you know, not obese. Mm-hmm. You are not having issues with blood sugar control,
right?
High blood pressure.
I think it would be like this, and it's, you know, it's very case specific. And so what we would always tell you is you have to see a board certified plastic surgeon, and they would have to look at you and tell you if you're a candidate or not. But in general, you want to have a BMI less than 30. Okay, maybe that's not possible, but somewhere around there.
Yeah, and BMI can be a little tricky. I mean, if someone has a lot of excess skin.
So you don't want to be morbidly obese if possible. Now, a lot of times people are, and BMIs are not great, but it's a starting point. Secondly, if you're diabetic, you want your hemoglobin A1C to be reasonable.
Under 6.5.
Yeah, less than 6.5, around 6, tightly controlled blood sugars. Why is that, Amy? How many times have we talked about diabetes on this podcast?
Well, we talk about it every time, because if you have uncontrolled blood sugars, you're not a candidate for surgery.
Because you're not going to heal well. You have a higher incidence of infections. You already had a higher incidence of infections by nature of the surgery. So then you're adding on to potential complications. Your blood pressure, if it was high, has to be under control, because these surgeries are large surface area surgeries, which have a higher incidence of hematoma. We should have talked about that. So bleeding around it, high blood pressure can lead to hematomas. So those are three things that are, you know, fairly universal in people that struggle with weight: diabetes, your actual weight, your BMI, and then high blood pressure. So those are the three things. But on top of that too, as Amy said, and I think is the most important thing, even if you haven't had weight loss surgery, we keep alluding to that, but the weight has to be somewhat stable, because you're really trying to formulate the contour of the entire lower body based on how you look right now. And so you don't want to go into a body lift and then gain 100 pounds, or go into a body lift and lose 100 pounds. So you have to be somewhere at a stable weight, wherever that is. It doesn't have to be perfect. And then you can move ahead.
Yeah. And that doesn't mean, I mean, everyone has weight fluctuations throughout their life. Like, absolutely. And that's why I say, like, your happy weight, like the weight that you can easily maintain without starving yourself and depriving yourself, like living a normal life, exercising the level that is absolutely lifetime sustainable. You know, not right after you come off of an Ironman triathlete event, like when you're at your 3% body fat. Yeah, just where you're stable. Let's talk a little bit about hematoma or seroma, because those are both things we should have mentioned as well.
We should have mentioned those.
Yep. We're going back to risks. We're going back a slide.
Can we just rewind?
Right? Nils is like, you're killing me. Back a slide.
Dude.
Yeah. So that is absolutely, we talked about.
Well, I mean, this is kind of shows you body lifts do have complications. We already talked about three things. I mean, you know, now we're talking about two more things that are slightly higher incidence than the other surgeries we do.
Yeah.
So seroma for sure.
Yep.
You can talk about that one.
Seroma is just fluid collection. So this can happen at any point in time. Usually once your drains are removed, people always hate drains. And then once they come out, your body just can't quite keep up with that amount of fluid and it starts to build. And the reason that's not good is because it builds tension on the flap. And that's why the drains were there in the first place. And I feel bad when people come in like, what did I do? Like, you've done nothing. Like, your body just can't quite handle this amount of inflammation. Like, it's a lot. We just drain it off, like super easy.
And seromas are just full of like delicious stuff to bacteria. It's like, what's the Texas Roadhouse where you get the chocolate waterfall? You just dip all the stuff in there. That's like a seroma to bacteria. Yeah. And so once you get a seroma, and that can definitely get secondarily infected, people who get these surgeries tend to have some issues usually at baseline. So,
well, they can also form a capsule around it that, then becomes an
distortion.
issue. Yeah.
And then hematoma is the same idea as a seroma, but that's usually right after surgery in most cases. Large surface area surgeries have a tendency, even though you cauterize during surgery, do a lot of different things to decrease the chance of bleeding after surgery. It can still happen. Mm-hmm. Rarely is that amount of bleeding going to cause life-threatening injury, but could it be enough to where you have to get a transfusion?
Or have to go back in and like open everything back up and clean out all the clot material. Like, that's happened to us before with the tummy tuck. I mean, that can happen with any surgery.
Yeah, the one that happened with the tummy tuck that I can remember she had a concomitant.
She had the mesh. I know, and
but she had the hernia repair at the same time.
That's what I mean. And it was around the mesh.
Hernia repair.
Yeah.
Which technically wasn't our part of the surgery. Can we just please note that?
But see, that's just my point is that it can happen from any surgery.
I know. But I mean, it was so funny. She's like, I'm so sorry that I decided to do the hernia repair. I'm like, look, you're like, I'm there.
The only reason she did the tummy tuck was because she had to have the hernia repair. Remember, she was the person who would never do anesthesia.
I told her, it's like, we're all in this together.
Yeah.
So it doesn't matter like where the bleeding came from. The bleeding we took care of it. She was totally fine afterwards when you took it out. Yeah, those are the three things. I think when you talk about who is a candidate, though, Amy, let's talk about the presentation. Like, if someone's at home, they're like, oh, I think I need a body lift. What kind of things would you see clinically or in the mirror that would clue you in that, a body lift would help? Yeah,
you have to have skin laxity that is on the abdomen and all the way around. I mean, so a lot of people who, think who needs a butt lift, essentially, like you're grabbing that skin on your low back or waistline and pulling up. Like, that's really the only way. You can't pull the glutes down. You can only pull them up. So if you have a saggy bottom, you got saddlebags or skin that's hanging over on the sides, your flanks, your abdomen. I mean, the flanks tend not to look like they're lax because, again, tension is pulling down. So then the buttocks just looks.
Yeah. And the flanks, where that hip dip area that people want to fill, around there's these tethering points, right?
Well, it's right on the bone.
Anatomically, kind of where your hip joint is. And those things kind of hold the skin in, where the butt doesn't have the luxury of having those tethering points. So, but you can still, even on the flanks, we've seen people with notable laxity. It can happen, especially with severe weight loss. So it's if you're looking at yourself, you definitely have laxity in the front on the belly. Even the mons area, where your pubic hair is, definitely the front of your thighs, a lot of laxity there, maybe undulating skin that kind of flows over itself. And then carrying around to the back, a very flat butt without contour, thighs that really have no definition, a lot of saggy skin. That's going to be a body lift, circumferential body lift, total body lift person. But definitely have to have a flat butt without contour, or very much a saggy butt. That really defines, that takes away from the contour of your butt for a total body lift.
Yeah. Yep. And that, I think most people looking in the mirror, if you need a body lift, are going to realize that that's probably, that there is excess skin all the way around.
So, most of the, at least in our practice, are we going to the break right now?
No, go ahead.
Oh, yeah.
Yeah, finish
at
your
least
thought.
At least at our practice, most of the patients we treat with body lifts have had notable weight loss. But I'll never forget, there was a patient when we were up in Aspen that was from somewhere else and had a body lift. And, she came in and she looked great. The body lift looked good. The incisions looked great. The scars looked good. The surgeon did a great job. And I was like, oh, yeah, how much weight did you lose? She goes, oh, none. Yep. I'm like, were you overweight? She goes, no, I just had a saggy butt and a little bit of loose skin below my belly button. And I'm like, you did a body lift?
Well, but I mean, that kind of is the solution.
I know, but I was like,
tummy tuck and a butt lift. Yeah.
She's like, she's like, yeah, just felt like it. I'm like, okay, you be you. And she looked great. So body lifts, technically speaking, aren't just for people with notable weight loss and notable sagginess.
Well, you do have to have excess skin. You have to have enough excess skin. I'm not convinced
she had a lot of excess skin.
As I said, you have to have excess skin.
You have to have something extra.
I didn't say a lot. I said excess.
Yeah, I mean, I was asking her what she looked like before the surgery, which is always problematic. But
right.
Yeah.
And I mean, to be fair, let's just say that, like, let's say you've had a pregnancy that really distended your abdomen, right? You need a tummy tuck, and maybe you have never done a squat in your life. You just have a flat butt, and it's saggy.
Still waiting on my t-shirt.
Squat ladies.
Squat ladies.
Deadlift.
Yeah.
So yeah, I mean, that absolutely is a possibility. You could be a normal weight and just have excess skin for whatever reason, for lack of muscle tone, for stretched out from pregnancy. Like, there could be other reasons.
Right.
So, but that's what I mean. Like, I didn't say you had to have had massive weight loss to be a candidate. I just said you had to have excess skin.
Yeah.
Yeah. So you just have to have enough skin. Yeah. All right. Let's take a quick break, hear word from our sponsors, and we'll be back.
We'll be back.
And we're back. And I thought of one more. It's not really a risk. Again, all of my things, I'm like, well, we just expect this. If you have, as many people do, tattoos on your trunk, on your low back, on your abdomen, you can expect that they will probably be altered by your body lift.
Right.
The mouse is still my favorite.
If you have tattoos around your lovely lady lumps, they'll probably be distorted.
Yep. We had a patient who
I had a dolphin and I turned it into like a koi fish, Yep. I took out the middle part.
No, the mouse though. We had a patient who had a mouse tattooed like kind of on her side hip area.
Yeah.
And all that was left was like its head. So I said to her after, I'm like, you need to get a cat. Like coming up and like,
Some gore out of
eating the rest of the mouse. Like, because there was enough of the mouse you could tell it was a mouse.
I mean,
but there was also enough of it gone that it was
Right.
gone. Like, yeah. So yeah.
That's a hard explanation. Why do you have a mouse head with a cat eating?
I mean, it's better, I guess, than a surgeon like cutting it up.
Yeah, it's true.
So yeah. So yeah, if you have tattoos in the areas
I
of
don't
surgery,
change my scars
No.
for shaping of tattoos.
Nope.
So
And we've changed a bunch. I mean, like, it
Yeah.
happens. Like, I would say
most
it's
people don't care.
pretty common.
Yeah.
Yep. And most people are usually excited because, as Nels mentioned, tattoo people tend to be addicted is maybe not the right word, but happy to, have more. So it gives
Yeah.
them an excuse to get more. Yeah. The patients who are like really ready after a tummy tuck, when can I get it tattooed? I'm like, slow your roll. Yeah. All right. Let's get back into body lifts. So let's talk about alternative or additional treatments. And you kind of mentioned that you may be adding stuff on, but there's obviously a limit with the length of the surgery as to what could be added on at the same time of surgery safely.
Sure. Alternative treatments to a body lift, there's not much. You can break down the components of the body lift, maybe do less, which we do all the time. You do the tummy tuck first and the butt lift later, or even like a belt lipectomy part, like so the sides first. We've done that. We've done only the sides. There's things that don't even approach a body lift that we do already, like body tight. So tighten the skin, you can remove fat, but
Yeah.
for at least
not a body
not
tight.
going to solve the problem. And the additional treatments we talked about before would be the stuff in the lower extremities in most cases. And that would be thigh lifts. And that's the big thing. Or contouring in the lower extremities with liposuction, most likely with body tight or some sort of energy assisted device. So those would be the things. But there really is no alternative to a body lift if you need it, if you truly need it. The patient we were talking about before, I'm not sure she totally needed a body lift, the one that really had, according to her, minimal problems. But still, even with someone like that, you cannot get the results of a body lift with any other procedure. Now, one thing we did talk about in this episode right here, I'm just throwing out episodes, our BBL episode, our fat transfer BBL episode. That's where Amy declared that we all should do squats.
I say that all the time.
Yeah. That can help a lot for people with saggy butts, but it won't lift the butt, but it can add volume, which fills out the butt.
It won't deal with the skin laxity, though.
But you could theoretically,
It will improve the contour.
Yeah, you could improve the contour, fill out the skin envelope better so the laxity is not as evident.
Yep.
And that's pretty much it. I think.
Yeah. And
Did I
that's
miss anything?
No, and that's
Yeah.
why I had this slide, because there really is no alternative. If you need a body lift, you can break it up into a front and a back body lift, but really the only way to solve this issue is a body lift. If you have extremely redundant skin that is hanging over for whatever reason, weight loss or otherwise, the only way to get rid of that is to cut it out. If you have recently lost a lot of weight, and that's why I before said, we'd want you to be at a stable weight for a year, because you will see that your body does try to bring it back in.
Yep.
So you will have some skin that kind of comes back in, but at some point, the excess that's been built, the new skin that your body has built to expand, And that's why with pregnancy, you see women
That's
that are
what
like a
moms- I was
size,
gonna say moms know
right?
this,
They're like
yeah.
a size 0,
Yeah.
but they have this skin that hangs over. And like, why is that? Because it only is going to go away to some extent.
Right.
So you should give it some time to let your body kind of naturally pull in what it can. Same thing, like if you've really started working out, like giving those muscles a chance to kind of get that skin to do something is going to be beneficial. But at the end of the day, there is no alternative.
Do you think in our careers, there, like, you know, okay, so we're 70, all right? We're 70 years old.
Okay.
There's going to be some like treatment gun you stick on somebody's belly with stem cells and everything else in it. And it just magically, the crepey skin goes away.
Crepey maybe, but not excess.
Yeah.
Because those are two different
Yeah, I
problems.
don't think it's ever going to happen.
Yeah. Do I think that there are going to be like ways to make your crepiness better? Yes. Ultimately, though, are we going to stop aging? And that's really what you're asking. And the answer to that is no, because even if you did that, and this is what you find when you dig into anti-aging treatments, you're not treating the underlying cause.
Well, I love sci-fi movies where they show like surgery 2,000 years from now, and it's always like some robot, and they're like,
Right.
2 minutes, everything's done.
Well, or it's just like they
Like,
scan
okay,
something
that makes
over
me
you.
feel
and you
real
fix
great
yourself.
about all my training. You know,
Well, in 2,000 years, you won't need it. I mean, wouldn't you be happy that you didn't need it, right? Because you'd look forever young too, and like everything would be fixed.
Yeah.
You'd be growing your own kidney, like everything would be great.
right?
Yeah. So do I think that will exist?
Like home brewing, like beer or something. How do you? I mean, is that you think that's going on at home? Like you're growing all your organs
you
at
just
home?
bank them. They just have another one for you. They just
Wow.
like take a picture of your DNA and are like, here's another kidney.
Totally getting off topic, but I did read an article about 3D printing of organs.
Yep. I've read that too. It's
Yeah.
scary. Well, they're 3D printing meat. Gross. But where were we with this?
Who knows?
Right. Will we be
What's the
forever young?
topic?
Stem cells and something that puts on your skin that magically it reduces the skin? No. And if someone tells you that cool sculpting is a good alternative, it is not. Like, it is absolutely not.
I mean, cool sculpting would probably be the worst thing you could
yeah,
do.
it would be the worst thing you do.
Yeah.
It could only make it worse, make the fact, it could only make
Just
it worse.
would make your loose skin look way worse.
Yeah, listen to our episode. Now I'm dropping episodes about skin tightening. Skin tightening, we talk a lot about body.
I was making Nils edit
right?
like crazy.
It's like, thanks, guys. Yeah, right. Like, episode 3, implant selection.
Starting with world history.
Yes, to the archives.
Starting with episode 1.
Well, all right. So there is no alternative. We could get on a shirt, body lifts. There is no alternative. So, yes. All right. Let's talk about what everybody really wants to know about, which is the downtime and the recovery.
I always love this picture. Sarah picked this out because it
this
has the
person
OG
looks so
cable
leisurely.
box underneath the TV, you know, because no one has cable boxes anymore, really.
Oh, who has cable?
No one has cable.
Just
Yeah.
streaming.
Everything's
So-
just plugged in
Yeah.
behind the TV.
So I always break down downtime and recovery into a couple different like tiers, essentially. You've got your daily activities, right? Like your ability to get dressed on your own, driving, etc. Like those kinds of things, like household chores. Like when are you be able to get back to just like being a human, like humaning, work. And then I have social activities, which depending on the person, these social activities could run the gamut, exercise and sex. So daily activities with a body lift, you can expect to need help with literally everything, including getting dressed and going to the bathroom for, I would say, at least 4 days. Plan on 4 days of having someone with you basically 24 hours a day to help you get out of bed, help you get dressed, help you do everything. And that's not because you're going to be like in so much pain and discomfort that you can't do those things. It's because you're literally going to need to figure out, how do I do these things? Right? Like, wow, I can't really bend over all the way to get socks on. Maybe I can wear flip-flops. It's summer. Maybe I do need to put socks on. Where's my helper? You know, those kinds of things. After that, I mean, pain is not usually a huge issue with this procedure. It's very uncomfortable, but it's not usually typically super painful. The areas where the drains are going to be painful. Like those are going to hurt just because that drain is kind of pulley and annoying. But as far as being like feeling pretty good being by yourself, I'd say 4 days would be my minimum.
Yeah,
Yeah.
I agree.
Driving, it's going to depend on you because you have to be completely off of pain medication for at least 2 days before you're okay to drive. And you have to be able to get in a car in a comfortable enough position to safely drive.
Yeah, you don't want to be driving, all of a sudden you have severe pain and you jerk the wheel and get in a wreck.
Yeah. And I tell people this even after a tummy tuck, like you will be shocked how much like core you need to work the pedal, you know? And that's if you don't have a clutch. If you have a standard transmission, which is anybody anymore, but if you do, I would plan on even a little bit more time. For driving, I usually say plan 2 weeks. Plan to have somebody available to help you do, errands, take your kids to school, whatever, for 2 weeks to be on the safe side. Housework, again, like I would definitely plan on, I just told a patient today who had just a breast lift with augmentation 2 weeks ago, asked if she could vacuum yet. I'm like, actually, no. Like, no, you cannot. Her vacuum is really heavy. I'm like, absolutely not. So, getting back to like, feeling like you can kind of take care of your household a little bit, probably about that 10 days to 2 weeks. And even then, like with a body lift, I would say you would be
3
really
weeks.
ahead of the game if you can have help for a month,
Yeah.
with just things like cleaning.
You're going to need
really.
help for 3 to 4 weeks.
Yep.
Yeah. And, obviously there's outliers. There's going to be someone listening to this like, I was back doing it in a week. I think most people need help 3 to 4 weeks.
Yeah. And planning for more help than you need is never a bad thing.
Right.
The worst thing that happens is we have a patient who, especially after like a big mommy makeover or a body lift, only has help for 2 weeks. And then they're like flying back, back east. They're flying back home hours away, and then there's nobody to help them. So planning for maybe, 4 weeks at least for something, to have somebody who's like kind of on call, like, oh, hey, if I need my kids picked up from school, or someone you can call to clean your house, that kind of thing is definitely going to behoove you.
So, we didn't really talk about this before. I just have to say this. So when you do this surgery, we talked about where the incision would be. Okay. And you take out the excess skin, you put your body in different positions, and you remove as much skin as possible. So it's pretty tight closure, and you lift that soft tissue, which is heavy, as best as possible. There's this guy named Ted Lockwood in the early 2000s out of Kansas City, a plastic surgeon that came up with this idea of suturing together the superficial fascial system, and which we call the SFS. So all of us, it doesn't matter what technique they use, they close these deep layers with these really big sutures. For me, it's a permanent suture, and you just do that all the way around, even with the tummy tucks, and definitely with the butt lifts, even with the belt lipectomies. So those sutures hurt.
Yeah, they'd be really achy.
Yeah, with our thigh lifts and our inner thigh lifts, we've had patients like 3 weeks later, like, what the hell? Why is this burning in there? Because you're putting a lot of tension on those sutures. They're there to hold everything up. And then you close the skin on top of that. And then even us, we put staples in as kind of an insurance policy for 7 days, maybe at the most. So any kind of movement's going to hurt. And those sutures are permanent. So every time you move, even like a month out, you might have a real stinger or a real pain
like
there.
some kind of deep burning.
Yeah, and that can be a problem, right? Like trying to contort your body to do things you never think about normally if you haven't had surgery, especially housework.
Mm-hmm.
Now,
and driving. That's why driving can also be somewhat of an issue.
Depending on your work, I mean, if you're emailing and kind of sitting at a desk, you could probably, be just fine within a couple of days. I would bet.
Yeah, if you don't have a what I call forward facing, where you're actually in front of people, I mean, even if you are, like with a body lift, everything that's happening is, below the belt, literally.
Yeah,
so
you just have to have a real high standing desk.
With a standing desk, yep. And the ability to know that like after surgery, you're going to feel more tired. And especially with this surgery, just because your body needs a lot of energy to heal. So if you have work that you can do from a standing position where you're not, having to be very, very active, you can be back to work in a couple of days.
Yep.
Absolutely. If you have a job that requires you to push, pull, lift, things that are heavy, I would say it's probably 4 to 6 weeks. And in the past, like when we've done these surgeries, thinking of one, that woman was worked for the school district. So she did it in the summer where she had those 3 months off. And really, I would recommend, if you have it all an active job, to have 4 weeks off, which is longer than any other surgery we do. Just because we talked about things like the incision is going to be slower to heal. There could be, some dehiscence, or, the wound is maybe not fully closed. Like these are things that you really, I would rather you plan to be off for 4 weeks and go back early. Great.
Yeah.
Rather than like, oh, I took 10 days of PTO and I have to, now I can't, I don't know what to do. So planning more than you need with this specific surgery, I would always recommend. Kind of same thing with the thigh lift. Like you always want to kind of plan for the longest we recommend. And then if you feel better, great. Like that's awesome. Social activities. Dr. Rowan, can somebody swim after a body lift?
Oh, my God.
Water polo, water aerobics. A lot of people do water aerobics. It's really popular.
Oh, yeah. Let me ask a question back to you. When can they do CrossFit, Amy? When can they do their CrossFit?
CrossFit, I would say you need to plan 12 weeks off of CrossFit.
Just stop CrossFit.
Yeah.
It's okay.
Well, if you love it, but 12 weeks. So social activities are going to depend on what they are. I mean, you could go out to dinner with friends probably even a couple of days later. You may not be the most comfortable sitting. Maybe sit at one of those high bar stools so you can kind of like lean, not sit. Maybe fine. Social activities like swimming or going to the beach, those things are going to be 6, 8, 12 weeks, depending on how your incision is healing. And I would plan for the 12 week again on this because that incision is long. And I never want someone to say, Amy said I could swim at 6 weeks. And I'm like, like 10 weeks later, I'm like, still no. So 12 weeks on a lot of those like active social activities. Same thing with exercise. Because this is going all the way around you, it's hard to get back to exercises. You can definitely start doing some upper body exercises.
Yeah, I was thinking like you could do some bicep curls or
tricep
pull-ups, maybe.
Ooh, pull-up, no way a pull-up. Can you imagine having your arms fully extended after a body lift and hanging your weight? Absolutely not. 12 weeks.
All right. Well, you just ruined that for me.
12 weeks. Yeah. No, 12 weeks.
Yeah.
Yeah. But, getting back to
I guess okay, biceps and triceps.
Yeah, biceps,
Pulleys and
tries,
pushes.
some shoulders, like lateral raises. Like there are definitely things you get back to at 2 weeks, and just more of those kind of mobility exercises at 4 weeks. At 6 weeks, maybe a little bit more, but things where you're really back to all of your normal exercise, I would plan 12 weeks.
Yep.
And even then, you may not be able to do some things for a while, like pull-ups would maybe be one of them. Sex is going to be in that same realm because, again, it needs to be comfortable for you, and you need to be in position that is not putting pressure or pain on any of your incision sites, which, because they are on the front and the back of you, makes this particularly harder.
Yep.
You also may not feel very comfortable supporting your own weight in some positions. So once your drains are out, all your sutures have been out, your incision's looking good.
No open wounds.
Yep.
Yeah.
Incision's closed, at least superficially closed. We'll probably say you're okay as long as it's comfortable. That's what I always say, comfortable for you, totally fine. But you should clear all of this with your own surgeon. That's
I don't have the sex talk with people.
I have it with
I barely had it with my kids, so I'm not. Yeah. That's Amy.
Every day. Yep.
Every day.
Every day, pretty much. I mean, and I don't know.
They're
I
like,
usually.
Dr. Bro, what about sex? I'm like, you know what? Who's a great person to talk to about this? Amy.
Amy. Yep. Talk to her about ED. She's an erection specialist.
Yes.
If you're not having sex, talk to her about that too.
Talk to her about that too.
Mm-hmm. I will help you with all of your sex questions. We're about to get a lot of interesting comments. But hey.
That would be a good episode. Just like, sex and plastic surgery. That would get a lot of hits.
I mean, that's kind of my life.
Yeah.
Like this is a thing, Oh my goodness. Okay, so I'll tell a funny story about this. So there was a patient, it was a man who'd had a direct excision neck lift. And his wife was here, and like the husband I had been talking about like when they could have sex, and the wife was scheduling a next appointment or something. So she was coming back into the room and like said something to me because like, I don't know, I think she thought he was afraid, but she was asking me about sunscreen, but she was whispering. So I was like, stop with the sex talk. I'm like, did what I say to him like not sink in? Like, it's fine. Like, you're safe to do it. So I go back in and I'm like going over all this again. And then she's like, and what about sunscreen? I'm like, oh, like that's what she said to me in the hallway, sunscreen.
So she's like, what is this? Dr. Martin's office just talking about sex the whole time.
Well, she wasn't in for the first part of the conversation, but I'm like, it's totally fine. Like you were safe. Like you're not gonna hurt anything. Like I literally was like going on and on with this person, and he was just sitting there like just letting me say all this. And
I would too.
Yeah.
I was
like,
just watching you flounder around.
Right. I'm like, oh gosh. I'm like, it's fine. It's safe. Yeah. So yeah.
All right.
I'm not like, ask me any of your plastic surgery related sex questions and I will be able to answer them.
We're definitely having an episode about sex. All right.
We got the one about ED.
Yeah. don't do it. All right. What's next?
Right. Next is the end. You've reached the end.
Whew, that was tough. That was difficult. Just like the surgery, a lot of work. Whenever you have a body lift and you're the surgeon, you have to get some sleep the night before.
Oh, seriously, that's a marathon. Yep.
A lot of times, offices that do these a lot will do two surgeons, right? Because it's two's better than one.
We always do an assistant.
We always do a surgical assistant who's like a physician assistant, really good at sewing. Because, time is of the essence. You don't want to keep people under anesthesia for 10, 12 hours. So any help you can have in terms of closure, doing the surgery quicker is absolutely necessary.
Yeah.
So
I think that's really where you also have to have a really good OR staff who really understands how you want a patient positioned so that all of that happens as quickly as possible, and a surgeon who has the ability to like actually be on their feet and do a surgery of that length. So choose your surgeon wisely.
Right.
Like this guy, look at these pulleys. He can do surgery for days.
How you doing? How you doing?
That's right. He will move you himself.
Yeah. So I'm going to be in like beach shorts on my next Google ad.
Get you the cut. We get you sleeveless scrubs.
How you doing?
All right.
I got your surgery.
So yeah, if you've made it to the end of this episode, thank you so much for listening. I really appreciate it. And I would love it if you'd leave us a comment, a rating, a review. It really helps people find us. If you know other people who are thinking about having a body lift, like this is a place to come where you can get some real information that is not real self, that is actually real.
This is real information. Yeah. And you think about it, we didn't try to sell you on the surgery. It's amazing. Mm-hmm. We told you a lot about the risks that are involved and the recovery and the things that matter. These are things that we're trying to kind of, expose everyone to if they're considering these surgeries. More importantly, so you go in with your eyes wide open and realize that a body lift will take you from one place to a totally different place, which is what's most amazing about it. And to be honest with you, from Amy and I's standpoint, it's super invigorating. I don't care that it's an 8-hour surgery. I get pumped up on those days. I'm ready to go. But there is a recovery, and that recovery is kind of a minefield of issues if you don't do everything right.
Or if you think it's only going to be 5 days of recovery.
Find a surgeon that does this on a regular basis. Find someone who's competent and make sure they, have, your safety in mind. So make sure they're talking to you about safety and things you need to do after surgery. That's what matters the most. But if you find that, you're going to have a great outcome. And even if you have like a dehiscence or a seroma or a little bleeding.
Now you know that those things are.
Yeah, but those things happen
terrible.
and you're still going to have a great result.
Yeah.
So.
Awesome. Well, here are all our social media handles and the phone number if you want to leave us a voicemail or a text. 303-630-9038. Like, text me.
If you want an Easter egg, go back and watch the last episode where Nils shows a video of himself.
That's right. You can see Nils.
What was that from, Nils?
Vikings? No.
It was,
it looked like it was from Vikings.
Yeah, it was literally someone who is super fit and has tons of muscles. I'm not seeing that right now in you, but maybe it's because you have a long sleeve shirt on.
That's because he's not all oiled up.
Yeah, he's not oiled up.
And tan.
All right.
I've been fighting for hours.
Yeah, I know. Right. That was after you worked out.
Yes. Yeah. All right. Well, we'll see everyone here next time.
See you later.